In this quick video, we will show you how you can potentially decide whether it's best to go to the emergency department or to the urgent care setting. These quick and simple tips could save you potentially big dollars. If you have a medical emergency, call 911 now. The reality check. Trying to save higher copays can backfire. If you go to an urgent care setting and you subsequently get transferred to the emergency department, there will be duplication of work. You'll get 2 physician charges. You may get double lab charges. If they draw blood at one place and repeat it again at the next, you're going to get charged twice for 2 blood draws. All that adds up. Urgent care centers are staffed differently and have different capabilities. The majority of urgent care settings have physician assistants or nurse practitioners who have a limited scope of practice compared to the ER, which is always having a physician on staff who has extensive training in emergency medicine. Ambulance rides are expensive. I know this for a fact. My mother-in-law fell on her bike, took a 2-mile ambulance ride to the ER. The total bill for that was $1,500. If you don't have insurance, that's huge. If you get transferred from an urgent care center to an ER, depending on whether you have insurance or whether your insurance covers all of it, that's a huge expense. Duplication of services is expensive. The emergency room may not have access to what was done in the urgent care setting. You may get repeat blood tests, repeat x-rays. All that adds up. This presentation is done in a brief, rapid-fire format. It's for educational purposes only and does not constitute medical advice. Always consult your own physician or healthcare provider. Watching this video does not establish a doctor-patient relationship. We'll start at the top and work our way down, cover common illnesses, and also discuss some more severe symptoms that should cause you to go to the emergency room. Other resources: many urgent care centers have websites that you can consult to see if your symptoms fit into what they are able to provide. Ask a Nurse hotline, insurance hotlines, those are resources you can use, and they can help you decide whether you're best seen in an emergency room or in urgent care. Urgent care can handle sore throat, ear pains, if you think you got something in your eye, your glands are swollen, you've got a rash, maybe some minor muscular neck pain, minor headaches, migraines, sinus infections, tooth pain, mono, which is a viral illness, concussions or sports-related injuries, those are handled in urgent care. If you have a severe headache, new or unusual headache, headaches after trauma such as falling off a ladder, car accident, any numbness or weakness of the face or arms or legs, severe neck pain, especially if any of this is very unusual, go to the emergency room. If you have a cough or cold, maybe some mild asthma because the weather's changing, you have some chronic lung disease like COPD, mild shortness of breath, joint pains, back pains, muscle spasms, muscle strains, urgent care is the place. If you have chest discomfort, particularly if it's with exertion, doing heavy activity, it could be pain or pressure, fullness, tightness, squeezing, any of the above, especially if short of breath or nauseous or sweaty, call 911. If you have chest pain and painful breathing and it's making you short of breath, that could be a blood clot in the lung. That's best handled in the emergency room. Chest pain going up into the back, neck, jaw, or arms, that's very worrisome. You need to see a doctor immediately. Mild abdominal pain, you're worried about your gallbladder, maybe you have some acid troubles, vomiting, diarrhea, food poisoning, bladder infections, pregnancy tests, kidney stones, bloody urine, vaginal discharge, checking for STDs, go to urgent care. If there's severe abdominal pain, particularly in elderly patients, if you have fever and bad abdominal pain, any history of an aneurysm or dilated blood vessel, recent abdominal surgeries, bloody stool, ER. Sprains, pains, joint pains, cuts, scrapes, bruises, go to the urgent care. Large wounds, complex wounds, especially of the face. Children with large complex wounds, also especially of the face or lips or near the eye, often require sedation. Most urgent cares are not set up to do that. Go to the ER. Wounds from severe mechanisms such as car accident, chainsaw, table saw, power saw, any loss of fingers or toes, or large amounts of tissue, go to the ER. Mild headaches, feeling weak, tired, maybe you have a bug or viral illness, the flu, food poisoning, urgent care. Any neurologic symptoms that are focal, by that I mean loss of strength, loss of sensation, trouble speaking, walking, confusion, sudden memory loss, anything like that could be a sign or symptom of a very severe, life-threatening problem. Don't waste time. Go to the emergency department. Call 911. Get there quickly. As you can see, we've outlined some generalizations that will help you decide whether urgent care or the ER is the right place. This is not an all-inclusive list. Cost savings could be potentially huge if you take in mind duplication of services, duplication of testing fees, lab fees, duplication of physician charges. There are resources out there to help you decide. Thank you.